Next, I'm just going to talk to you about self-breast exams real quick. Do you perform them yourself at home?
Yes, I do.
Okay, and when do you perform those?
1 week after my period.
Okay, that's the right time to do it. And when I'm not going to do one today, but I'm just going to tell you, when you do perform them at home, you want to do a 1 week post-period. You want to inspect the breasts in the mirror, make sure they're symmetrical. You want to look for any lesions. You want to assess the venous pattern. You want to look at the nipples, and you want to make sure they point outward and not like in any different directions. You want to put your hand on your hips, and you want to bend over and check and see if there's any dimpling present or any puckering. You'll also put one hand behind your head and lay over a pillow, and then move down with 3 finger pads and feel for any lumps, bumps, anything abnormal. You also want to check your axilla under here, just if there's any abnormal lip activity or anything under there. And you would also want to palpate each nipple and squeeze it, make sure there's no discharge. Okay? I'm just going to check your axilla. While you're here, any tenderness there?
No.
Anything here?
No.
Okay. Let's see. Now I'm going to check your central nodes, which are here, your lateral nodes. Any tenderness?
No.
Okay, and then I would check your pectoral nodes. Anything here?
No.
Okay, your subscapular nodes.
No.
Okay, your internal mammary nodes.
Nope.
Okay, and your epitrocular nodes.
No.
Okay. All right. Next, I'm going to just examine your pulses. Can I check your radial pulse, please? Okay, that's a strong +2. And your brachial pulse. All right, that's also a +2. Could you just lay back and I'm going to check you. Puckering, you'll also put one hand behind your head and lay over a pillow, and then move down with 3 finger pads and feel for any lumps, bumps, anything abnormal. You also want to check your axilla under here, just if there's any abnormal lip activity or anything under there. And you would also want to palpate each nipple and squeeze it, make sure there's no discharge. Okay? I'm just going to check your axilla. While you're here, any tenderness there?
No.
Anything here?
No.
Okay. Let's see. Now I'm going to check your central nodes, which are here, your lateral nodes. Any tenderness?
No.
Okay, and then I would check your pectoral nodes. Anything here?
No.
Okay, your subscapular nodes.
No.
Okay, your internal mammary nodes.
Nope.
Okay, and your epitrocular nodes.
No.
Okay. All right. Next, I'm going to just examine your pulses. Can I check your radial pulse, please? Okay, that's a strong +2. And your brachial pulse. All right, that's also a +2. Could you just lay back and I'm going to check you for jugular vein distension. I would just shine this light here on you. See if there's any jugular vein distension or pulsations, which there are not, which is a normal finding. Okay. Now, next I'm going to inspect your anterior chest for any heaves or PMI. There's no heaves present. I'm going to palpate your apical pulse. Then I would palpate your other pulses. I would palpate your aortic pulse and then your pulmonic pulse, Erb's point, the tricuspid area, the mitral area, and the apical area. And there are no thrills or heaves present. Next, I'm going to auscultate those same areas. First, I'm going to use the diaphragm on my stethoscope. First, I'm going to listen to the aortic then the pulmonic, Erb's point, then the tricuspid area, the mitral area. Okay, and then I would listen again with the bell of my stethoscope. At the aortic spot, S2 is going to be louder than S1. At the pulmonic, S2 is also louder than S1. At Erb's point, S1 and S2 are equal. At the tricuspid area, S1 sounds greater than S2. And at the mitral area, S1 also sounds greater than S2. I would also assess these in different positions. I would assess her supine, which she is now. I would assess her left lateral and sitting up, leaning forward. But for the sake of today's video, we'll only do supine. And I'm going to listen to your apical pulse for a full 60 seconds now. And your apical pulse is normal at 68 beats per minute. Okay, now I'm going to assess your abdomen. Normally I would have you lay here with your knees bent, but for the sake of the video I'm going to have you keep them down so you can see. Okay. First I'm going to assess your umbilicus. It's normal, it's intact. Next I would assess the contour. Your stomach is flat. It looks symmetrical. There's no presence of enlarged organs. There's no scars, masses, no visible peristalsis. There's no pulsations. Next I'm going to auscultate all 4 quadrants using the diaphragm of my stethoscope. And I would listen for a full minute. Now I'm going to use the bell of my stethoscope and listen for any bruits over the aortic, the renal, the iliac, and the femoral arteries. So the aortic, the renal, the iliac, and the femoral. There are no bruits, and also she had normal vowel sounds. Now I'm going to percuss all 4 quadrants. So. Any tenderness?
No.
Okay. Now I'm going to percuss for splenic dullness. Alright, and there is splenic dullness present. Next, I'm going to percuss and measure for liver dullness. Okay, and I would tape the top of where I percuss the liver dullness and the bottom, and then I would measure, and it would be about 8 centimeters as normal. Okay. Now I'm going to palpate the liver border, which is non-palpable, and the spleen, which is also non-palpable. Okay, I'm going to palpate your inguinal nodes and your femoral pulse. So your inguinal nodes are here. Do you feel any tenderness there?
No.
I don't feel them present, which is normal. And palpate your femoral pulses, which is +2 on the side. I would also check the other side. Okay, and could I have you do a little crunch for me when you sit up? And you have strong abdominal muscles. Okay, now you can sit up. Next, I would assess your peripheral vascular. I would look at the skin on your legs, make sure it's even in color. Should I sit on the side? I would assess the texture of your skin. It's soft, smooth, it's dry, it's pinkish white. There's no distinct venous patterns present. There's no swelling or edema. I'm going to palpate your pulses. I would do them bilaterally, but for the sake of the video, again, I'll just do this one leg. I would do the popliteal pulse, which would be +2. And then I would do the posterior tibial pulse, which is also +2. And then I would do the dorsalis pedis, which is also +2. Next, I'm going to inspect the ankles, the feet. I'm going to palpate for any tenderness, any swelling, any edema, any tenderness when I touch your ankles or your feet. Okay, I'm going to palpate your Achilles tendon. I'm going to palpate the MTP joint, any tenderness there.
No.
Okay, now I'm going to do range of motion and muscle strength of your ankle. Could you flex your foot up? Okay, and could you down? Could you do side to side, the rotation? Okay. Could you push against my hand? Push down? Okay, and could you push up against my hand? Okay, so +5 strength of the ankle. Next I'm going to inspect and palpate your knees, because I do uncross the other side. And palpate them, any tenderness?
No.
Okay. I'm going to test range of motion. Could you put your leg out straight? And could you bend the back? Could you adduct your leg? Abduct? Okay. And could you... I'm trying to think. Okay, so you have... There you go. Okay. So you have full range of motion of your knees. Next, if you want to lay back, I'm just going to palpate your hip. Okay, any tenderness?
No tenderness.
Okay, and could you, just for range of motion, could you put your leg up? Okay, and that's, and then that I'd have you put it back, but you're laying down, and then could you bring it out, and then bring it in, cross it over, okay, and rotate. Okay, so you have full range of motion of your hip joint. Okay, I'm going to have you sit up again. I'm going to inspect and palpate your fingers and your wrists. Could I just see your fingers? Any pain in your finger joints there?
No.
How about in your wrists?
No.
Okay, could you wiggle your fingers like this for me? Okay, range of motion of your fingers. Could you do your wrists, up and back, side to side? Okay, you have full range of motion of your wrists. Could you flip your hands over for me? And could you push up on my hands? Okay, and then flip your hands over. Don't let me push down. Okay. You have +5 strength in both wrists. Next, I'm going to test you for carpal tunnel. Could you put your hands like this for me? And then if I go like this, do you have any numbness or tingling?
No.
Okay. I would do this bilaterally. Any numbness or tingling?
No.
Okay, and then could you put your hands into acute flexion for me? And we would do this for a whole minute. And if you had any numbness or tingling, that would be a sign of carpal tunnel as well. I'm going to inspect your nail beds. They are painted red. I would check your capillary refill. It's less than 3 seconds. Could you make a diamond for me? Okay, you're nailing. I see 160 degrees there. Okay. All right, now I'm going to test the muscle strength of your forearm. Could you push against my arm? All right, and could you push against my arm this way? Okay, and then could you put your arms out? Push up against me. There you go. Okay. Your arm strength is +5. I'm going to palpate your elbows. Any tenderness there? Sorry, does that tickle?
No.
And there's no swelling. Can you flex and extend your arms? Supinate and pronate, up and down. Okay. Next, we're going to do rapid alternating finger movements. Could you copy this? All right, so your rapid alternating finger movements are intact. Next, I'm going to have you test rapid alternating hand movements. So can you tap your legs and then put your hands up, tap them and go like this? Okay, so that's intact. Now I'm going to test and grade your reflexes. So take this, and this, and okay. So for the reflexes, okay, first I'm gonna check your bicep reflex. Just relax your arm. Okay. Alright, that was +2. Now I'm going to check your tricep reflex, and I'm going to just, okay, and that was +2. Now I'm going to do your brachioradialis, which is here, and that one was also +2. Now I'm going to check your knee. Could I have you clasp your hands together? Sometimes it's easier to check your knee reflex when you have your hands clasped, so you're not focused on the actual reflex. Okay, and that was +2. I'm going to check your ankle reflex. Okay, and that was +2. Now I'm going to check, we're going to check for the Babinski reflex, which should not be present in a baby over 2 years old. I'll use this foot, so I would take my finger or a fine tool and I would drag it up the side of the foot like this, and the toes would fan out, but you won't have that. Okay, next I'll check for ankle clonus. Could I borrow one of your feet, please, again? So I would push your foot back like this, and then I'll just let it fall. And there's no clonus present. Next I'm going to check the sensation in your arms, your midsection, and your legs. So I'm just going to do a test called sharp dull. So I'll either touch you with this side, which would be sharp, or that side, which would be dull. Could you close your eyes for me? Okay.
Sharp.
Okay.
Dull. Sharp.
Okay.
Dull.
Okay.
Sharp.
Okay.
Dull.
Okay. So your sensation in your arms and legs is, and your trunk is intact. Now I'm going to do the vibration. Can you tell me when you feel the vibration?
Yep.
Okay, and I'm going to just check your... Okay. So you can feel the vibration. Now I'm going to change the position of your fingers. So I'm going to either put it up or down and tell me when you feel me move it and what position I move it to. So keep your eyes closed.
Up. Down. Up. Up. Down.
Okay, so that is intact. Next, I'm going to check your stereognosis. I'm going to put an object in your hand, and you can tell me what it is. Close your eyes.
Paperclip.
Okay, and now I'm going to do check your graphesthesia. Put it around the palm of your hand and close your eyes. I'm going to draw a number in your hand.
4.
Okay, so that your graphesthesia is intact. So I'm just going to do 2-point discrimination. I'm going to do it on your finger and on your back. So I'm going to either touch you with 1 point or 2 points. So tell me when you can feel the 2 points, okay? Close your eyes.
1. 2.
Okay. And I would hold that, and I would measure it. And that's about 2.5 centimeters, which is normal. Okay. I'm going to position you to standing. I'm just going to inspect and palpate your shoulders. I'm going to test the range of motion of your shoulders. Can you put your arms out? And can you put them down? Can you rotate them? Okay, so you can abduct rotation. Can you flex them and extend them? Okay, hyperextend them. Okay. I'm going to just check the strength. Could you push up? Okay. So you have +5 strength in your shoulders. That also checked cranial nerve 11. Could you walk across the room so I could assess your gait? Okay, you have steady gait. Could I have you stand on one foot? You can hold this if you have to. Put your heel to your knee and then drag it down for me. Okay, you have good coordination. I'm going to assess your palmar drift now. If you could close your eyes and put your arms out with your palms up. Okay. And there's no palmar drift present. That's a good finding. And then I'm just going to do the Romberg test, which I'm going to have you stand there, close your eyes, and okay. So there's minimal to no swing, which is a normal finding. All right, thank you, Chantel.
You're welcome.